It's less important how many operations you do. It's more important how many surgeons you have trained. I think that when I finally total up the usefulness of my career, I won't be as proud of how many cases I did as I would be of how many surgeons I trained. Because in the end, that will determine a lot more. I am from Kuala Lumpur. I am presently head of department of the Department of Cardiothoracic and Vascular Surgery at IJN, and that's quite a mouthful. Adult cardiac and pediatric cardiac, all of which are extremely high performers. So in the end, it's not such a difficult job. It's quite an easy job. It's just a question of making sure I don't get in their way and allow them to do the work that they do. Actually, I specialize in cardiac surgery. A lot of people are confused as to the differences between cardiology and cardiac surgery. Cardiologists do the medical side of things, the angioplasties, the stents, that part of the work. Cardiac surgeons do the operating part of it. So bypass surgery, heart valve repair, heart valve replacement, lung transplant, heart transplant, those would be the surgeons. For surgeons, generally, the work is the hobby. And so that's the nice thing about this. The most important thing that we are engaged in now is training the next generation of surgeons. And we are involved in two programs. The parallel pathway, which is very much in the news now, and also the UITM IJN Masters and Doctorate programs. This will ensure that the next generation of cardiac surgeons are ready to serve the needs of Malaysia. It has always been the hospital, in terms of cardiac surgery, that delivers the most cutting edge of technologies and also the highest number. If you look at the number of cases that are done in IJN, we do about 4,500 open hearts in a year. That's a huge number. I was a fellow at the Mayo Clinic in Rochester, Minnesota, and that, together with the Cleveland Clinic, are the high volume centers in the US, and they do about 4,000, 5,000 as well. So we worldwide rank among the high volume centers. We are very proud with what we've done. Malaysia offers the whole range of medical treatment, from the most cutting edge heart valve devices that are deployed via catheter, off-pump surgery, minimally invasive surgery, together with conventional surgery, which most patients require. 10 years down the line, percutaneous intervention in which we can treat dissection of arteries, has completely changed, and we've moved with those times as well. They must realize that the limitations that are there are actually mostly in their minds. That it's like Muhammad Ali said, it's not the mountain ahead that is the barrier, it is the pebble in your shoe. So if you remove that limitation and you free your mind, you'd be able to do a lot. I think our researchers need to think out of the box, think beyond what are the usual established confines that limit the research that they intend to do, and go for it. It's part of the work that we do. It's making sure that the cases that I do, somebody learns from them. It's less important how many operations you do. It's more important how many surgeons you have trained. I think that when I finally total up the usefulness of my career, I won't be as proud of how many cases I did as I would be of how many surgeons I trained. Because in the end, that will determine a lot more.